Hi everyone, this is my hypothyroidism case presentation. A 22-year-old female presents to her primary care office for vague symptoms of fatigue and unexplained weight gain. She has a history of celiac disease and follows a gluten-free, low-inflammatory diet. Her vital signs are remarkable for sinus bradycardia with a heart rate of 46 beats per minute confirmed by EKG, and a physical exam indicates pale, cool, and dry skin. Her blood work reflects an elevated TSH level of 7, a decreased T3 level of 48, a decreased T4 level of 3, elevated creatinine kinase, and the presence of antithyroid peroxidase, suggesting hypothyroidism in the setting of Hashimoto thyroiditis. The patient is counseled on her new diagnosis and educated on its autoimmune nature, which likely coincides with her celiac disease. A thyroid ultrasound is ordered to assess for thyroid nodules. She is started on oral thyroid hormone replacement at 1.8 micrograms per kilogram per day, with reevaluation of thyroid hormone levels in 6 to 8 weeks.